Hello, everybody. How's it going?
Hello.
Oh, I got a response from Miss Lestraps.
Hey, and look who's sitting with me.
I see Mr. Lestraps.
Yes.
This just lets me know this is going to be a wonderful evening. I'm looking forward to it. And I'm thankful for everyone else here on the call. I do want to remind everyone that today, this recording here for this very important Breathe Easier, Take Charge of Your Health event will be recorded. And so I also ask everybody to put their devices on mute so that way we can properly go through the event and get a good lesson from it all and enjoy it. As for who I am Thurgood Brooks. I'm a Rock Island resident, lifelong, outside of my 4.5 years when I went off to school, where I graduated. I went to 3 different universities, but I graduated from Western Illinois, Macomb, studying history and political science. And I returned home to begin to work here in the community in various different avenues and ways in which, from youth to coaching. I coached the high school. I work at the Martin Luther King Center as a family advocate. And I try to stay deeply involved in a lot of different endeavors that are important, which is very humbling for me to be here before you today, as I said before, for such an important event to our community and for our loved ones. Lung cancer is the leading cause of cancer death in the United States, killing nearly 160,000 people every year. And Black men are disproportionately affected by lung cancer. In fact, at least 30% higher than white men, despite having similar smoking rates. So here today we have Dr., and I hope I say your name correct, Nicholas Yerkes.
Close. It's Yerkes, but that's okay.
Yerkes. All right, from here on out, I got it, so it's all good. Dr. Yerkes. He's a surgeon at UnityPoint Health. He's going to share about things throughout. Later on, he's going to be our keynote speaker, about how we can improve Black men's health. So I'd like everyone to welcome Dr. Yerkes here. I'm looking forward to learning from him. And so to oftentimes, before we move on to in our agenda, oftentimes Black men and men, but Black men in general, we tend to overlook what is important tomorrow, so to speak. I believe we do very well with addressing day-to-day issues, paying the bills, making sure that there's food at the table, being around our loved ones, and doing things that men are supposed to do, quote unquote, in quotations. But oftentimes I believe we fail or don't really appreciate or understand the importance of our value long term. It's essential. Our value is more than today. That's why we are encouraging we should have life insurance, because we need to further our offspring's lives in the future. And so that's why it's important, I believe, for us to do better with our health. Now looking forward to, we have some videos today. As I said before, we have Dr. Yerkes. So please pay close attention, And we will have questions at the end. So there's a comment box, or you can chat a question in, and please chat it away. And at the end, we will go over them and we'll do our best to answer. And we'll follow up with some action steps we can take toward the end as we maneuver through and learn about the importance of our lung health. And so with that, I do believe you heard enough from me. And we're going to move along. I believe we have a video next up here, a video about someone by the name of Jameson. And so please enjoy.
When I had my first asthma attack, I was terrified, to be honest. I was scared because I didn't know what was happening. I didn't know why I wasn't able to breathe. I didn't know anything. I was just known that I couldn't breathe. I was at work and somebody was smoking and it just got to me.
I received a text message from Jameson, and the text message said, "Where are you?" And I said, "I'm at home." "Why?" And he said, "Well, I'm trying to get air." And I knew that that was not a good sign.
So I called my mother and she came and got me and took me to the hospital.
And so I turned my flashers on, my emergency lights on, like it was a siren, I guess, because I was driving fast. And I just held his hand because it was very scary. And I just held his hand. I told him just squeeze it every now and then, just so I know that he's breathing. I didn't want him to talk because I wanted him to save as much breath as he could. Within a matter of minutes, they had him hooked up to an IV. They had the nebulizer hooked up, had him on a breathing treatment, continuous breathing treatments, and they were just doing everything they could to open up his lungs.
When I was in the hospital, I was there for about 3 to 4 days, and I wanted to go home, but then again I didn't because I knew in the hospital there was no smoking, and outside of the hospital there was a lot of smoking, and I didn't want to have to go through that again.
Secondhand smoke exposure triggers my son's severe asthma attacks.
Secondhand smoke. It's something that is, I think, we definitely overlook. I can remember times, and thank God, more recently there have been laws to prevent or to regulate, I would say, how often secondhand smoke is frequent, I would say. We can't do it in the car anymore with the young ones here in Illinois. Can't smoke in restaurants anymore for some time now. And so thank God and appreciate those type of things. However, but we're able to see in this video here with Jameson just how much of an impact it can have on those that we love, our kids, our nephews, our nieces, our grandkids, and those that we hold dear to our heart. And so as we are moving through this, something that we should all consider and be mindful of. For not only ourselves, but for others. And so I want to talk a little bit about Dr. Yerkes, whom will come before us next and give us an abundance of knowledge in the time he has. And I hope I'm not, I know I'm not putting pressure on him because he's a very skilled individual, very knowledgeable. And so Dr. Yerkes, as I've said before, he's a surgeon at UnityPoint Health at Trinity. He's received his training at St. George University Medical School, where he received his MD. His residency in medicine occurred at the SUNY Upstate Medical University with the fellowship in medicine at the University of Iowa Hospitals and Clinics. He's a board certified surgeon from the American Board of Surgery and from the American Board of Surgery, He is going to share with us the next few minutes about the disparities between Black men and other races, the factors you want to pay attention to for preventing lung disease. And lastly, Dr. Yerkes is going to share some things that you can do to take charge of your young lung health, right away here in the now. And so I want to again thank Dr. Yerkes, and I'll pass over to him to speak for us here.
Well, thank you, Mr. Brooks. I appreciate the ability to come and talk to everybody tonight, and it's very nice to have you guys here, especially that November is Lung Cancer Awareness Month. So it's very critical, and it's very crucial that we go over things so that we can make people understand the things that help with your lung health as well as lung cancer. So what we're going to talk about is we want to answer what are the disparities among Black and other races when it comes to lung cancer? What factors increase the risk of lung cancer or lung disease? And then finally, what can the patient do to take back charge of their lung health and the health of the people within their household? So, as Mr. Brooks said, lung cancer is a leading cause of death in the United States, and it kills approximately 160,000 people each year. It accounts for an estimated 25% of all cancer diagnoses. When we talk about cancer in general, if we talk about the state of Iowa, for men, prostate cancer is number 1 and lung cancer is number 2. For women, it's breast cancer followed by lung cancer. So the incidence or how frequent lung cancer happens in the population is number 2 in the state of Iowa, and it is number 1 for leading cause of cancer deaths. In the nation, it mirrors the state in the sense of that the cancer deaths are most related to lung cancer, and actually you could take breast cancer, prostate cancer, and colon cancer and combine them, and it equals the deaths for lung cancer. When we look about lung cancer incidence, and again, this is how frequently it happens by race, the incidence is higher in Black men compared to all other races. Lung cancer is the second most common cancer among Black men, prostate cancer being number 1, and 6% of Black men will develop lung cancer over their lifetime. Now, that doesn't seem like a lot. However, in the scheme of cancers as a whole, it is significant. When we look at mortality or the risk of death among the races, lung cancer mortality is 30% higher in Black men than in white men. The 5-year survival rate, once diagnosed, is only 15%, making this one of the deadliest cancers, as we had talked about earlier. One of the reasons why the survival rate is so low is these patients are being reached, unfortunately, later on in their fight for this cancer. So the stages are higher, and therefore survival is less because it's caught later. When we talk about the late stage diagnosis of cancer, Black men are 10% more likely to be diagnosed at a later stage than white men. When we look at this, we have to say, well, why is it? Why are we catching people later than other populations? And we look at barriers to healthcare access. Obviously, I came from Syracuse, New York before, and the Quad Cities area is much like that of Syracuse as far as population density and access. And what we have issues with in some areas is the lack of health insurance. When people don't have health insurance, they don't see a primary care physician, they don't see people that needs to get screened, and therefore that does not happen. We see that also in people with blood pressure management for heart disease. Others are expenses of care. Co-payments for some insurances can be extraordinarily high to see a physician for a screening test or for follow-up care outside of the primary care physician, such as a chest surgeon like myself, or a pulmonologist, which is the lung doctor, or even an oncologist if that needs to be made. So therefore, the expenses there that can be barriers. We also find that there are issues when barriers are to travel. People come from distances in rural areas to travel to get into the healthcare that they need, and traveling can be difficult because some people don't have cars, and public transportation is very difficult, as well as actually the cost of that. So that's another access issue that we have. When we talk about health behaviors, as Mr. Brooks says, most people and some people live in the now. And when you do that, we don't adhere to tomorrow and the treatments that we need. So it's very important that even though you're feeling fine, that you should get your primary care checkup yearly and then follow up as needed with these testing. Some people say, well, we'll put it off till next year, we'll put it off till a year after, and we don't see timely follow-up. And then when it happens, things are later and it could be worse for the patient. I like to tell people, you do scheduled maintenance on your car, you do scheduled maintenance on yourself. So prevalence for risk factors. Obviously, when we talk about lung cancer, it's smoking. Smoking is the #1 cause for lung cancer. It accounts for about between 75% to 80% of all lung cancers. The rest are actually non-smokers or environmental issues. When we talk about environmental, one of the most things that come to mind is working environment. People that do a lot of construction here at the Arsenal back in the day or recent or up until recently, we talk about asbestos, and people that have exposure to asbestos can have a higher incidence of lung cancer, even regular lung cancer. Another environmental issue is radon. Radon in your homes can increase your risk for developing lung cancer as much as 11 to 12%. And we'll talk about that a little later. There's also potential genetic differences in tumors. What we're trying to do now with lung cancers is, and actually all cancers for this matter, is are there availabilities in our own body to fight them off? So our research departments are hard at work to try to find certain medications that we can access our own body's immune system to help fight off certain cancers. For example, for lung cancer, we talk about a drug called Keytruda, and that's helpful in people that actually have the markers for the cancer. However, if you took everybody who had that particular lung cancer, we would see that only between 15 to sometimes only as high as 20% of all those people have those markers. So we still have 80% of people that would not be able to use that. But we're making strides and trying to make it so that we can access this more. So now going into what factors can increase your risk of lung cancer or lung disease. As we discussed, smoking is the leading cause of cancer. It's about 80%, 75 to 80% of all cancer deaths are related to smoking. Many others can be exposed, as we talked about earlier, with secondhand smoke. Secondhand smoke is an irritant. Anything that can be an irritant to your lungs has the ability to cause cancer. As I like to explain, if you go out in the sun and burn all the time and you blister, at some point when your body is repairing itself, it may mess up and give you skin cancer. That's why people that go out in the sun a lot, especially now with the sun being as dangerous as it can be in some areas, can develop skin cancers. There are other known causes of lung cancer, i.e. the areas that we talked about with radon and asbestos in the workplace. The EPA is actually helping to help mitigations of radon and to help people within the workplace not be able or exposed to those as they were before. And a small percentage of lung cancers are people with no apparent risk factors. That's why we say sometimes as much as 20 to 25% of lung cancers are people who are non-smokers or really didn't have an exposure to a workplace or an environmental. So what are the signs of lung cancer? Well, that's very difficult to talk about. These are some. When we talk about lung cancer, unfortunately, if you have symptoms, it usually isn't a good sign because it could be a later stage. And this is one that goes back to what we said before about people not getting screening and going to see people because they feel fine. If you have a cough that doesn't go away or gets worse, that's something that's irritating within your lungs. Your lungs are trying to help, and if it continues, there may be in the airway or the lung that's causing it. Hoarseness. There are nerves that go to your voice box that run through your chest, And if the cancer has aggravated them, some people get hoarse. Chest pain. Chest pain is a late indicator for lung cancer in the sense that you actually have no pain fibers in your lungs. That's why people can present with late stage or very large cancers, because by the time that you have chest pain, that means that that cancer has gotten close to the chest wall, which is where your ribs are, and that's where the nerves lie. And that's where if you have chest pain, that's not a good sign. Shortness of breath, meaning that things have gotten larger to the point where they've caused an issue with your breathing. And people that have frequent lung infections, such as bronchitis or pneumonia, where they have chronic irritation within the lungs, can lead them to a higher incidence of cancer. If cancer gets in the airway and you constantly cough or clear your throat, you can irritate the cancer, and that's where people have what we call hemoptysis, or coughing up blood, and that's because that cancer in the airway is aggravated by you coughing, your body's trying to get it out, and then it bleeds. And then finally, unexplained weight loss. Some cancers can, if they're large enough, make you lose weight because your body's nutrition is being used up by the cancer instead of the normal day-to-day activities. So finally, what can you do to take charge of your lung health? Obviously, number one, don't smoke. It's very hard. There are wonderful venues to try to help people to quit smoking. Cold turkey is very difficult. We have medications, we have counselors, and just because it didn't work once doesn't mean you can't try again. We also find that it's difficult if both partners in the family smoke. You have to do it as a team. Two people that are smoking, if one wants to quit, it's very difficult if the other one tries to continues to smoke. Obviously, avoid secondhand smoke. Somebody smokes within the household, or you're at family member's house or work areas. It's difficult to not be able to get in there, but that's where you have to stand up and say you can't be in those areas and try to do that. We're getting better, obviously, as Mr. Brooks had said. You can't smoke, in the car with your children. You can't smoke in public areas such as restaurants. However, that being said, the national average for people that are smoking today is 15.5%. In the state of Iowa, it's 16.6%, and in Illinois, we are at baseline at 15.5%, but still, that's a good amount of the population that's still smoking. We talked about radon. There are radon mitigation factors that can help with your house. You can get a kit that's $10 to $20 to see what the exposure is in your house, and there are mitigations to that, and the EPA actually will help fund people to help that as well. That is outside of smoking, probably, and exposure within your workplace. The other leading cause of lung cancer is radon exposure. Obviously, don't expose yourself to cancer-causing chemicals. This would be the asbestos in the workplace for people that do construction or masonry. That's very important to not be exposed to those things. And finally, you want to follow a healthy diet. People should always do the best to try to eat healthy, because not only does that help your body protect against cancers and give you the nutrition it does, it also is going to help for blood pressure and cardiovascular health, which is extraordinarily important. So how does your body react to quitting smoking, and why should you quit? So once you stop smoking, in 20 minutes, your heart and your blood pressure drop and go back to a more better resting level. Within 12 hours, carbon monoxide level in your blood drops to normal. Carbon monoxide is what you inhale. This is what's in you. This is what is also in your car exhaust, and this gets exhaled out of your lungs since you stop smoking, and it gets out of your blood and goes back to a normal state. Within a couple weeks to months, your circulation improves and your lung function increases. Your lungs aren't getting aggravated constantly by smoking, and therefore it can increase help with your function. The reason why people have coughing and increased secretions and clearing their throat is because you actually have little hairs within the main airways and down to the smaller airways. They're called cilia. What happens is the smoke kills the cilia, so people can't bring up all that normal mucus in the lungs when people clear their throat. That's why they get what we call smoker's cough in the morning, because their body's trying to bring up all that mucus and they can't because they don't have the cilia. Within 1 to 9 months, that ciliary escalator helps to clear your functions to help prevent pneumonias and infections. At 1 year, your risk for coronary artery disease is half as someone who continues to smoke in just a year. And obviously, cardiovascular health is extraordinarily important, as it's the #1 killer in the country, and cancer is #2. At 5 years, the risk of mouth, throat, esophagus, and bladder cancer is cut in half, and cervical cancer for women falls to that of a non-smoker. Stroke risk can fall to a non-smoker risk in 2 to 5 years. People that also smoke do get mouth, throat, and esophagus cancer because that's where the irritants, as well as the lungs, that's where they touch and go. So people can get mouth and throat cancer, especially people that think that smoke-free tobacco and dip is actually better than smoking. It's not, because it'll also irritate your mouth, your throat, and your esophagus. At 10 years, the risk of dying from lung cancer is about that of a person who is still smoking, and the risk of larynx, which is your voice box, and your pancreas rates decrease. And finally, the most important, at 15 years, your risk of coronary artery disease is back to baseline, back to that of a non-smoker. So what is the single most important thing is to get screened. Low-dose CT screening has been around for at least 6 years. There was a study in 2015, and it showed that we needed to improve greatly in our screening, and low-dose CT scans is that answer. Chest x-rays will only pick up things the size of a marble, so low-dose CT screening is very important. It can detect things up to millimeters in size, so you're looking at probably half the size of a lentil or a pea. And studies have shown that CT lung screening can lower the risk of death from lung cancer by 20% in people who are high risk. In order to qualify, you have to meet certain guidelines. So this just changed within the past year. So if you're 50 to 80 years old, obviously to get screened, you have to be in fairly good health. If you're a current smoker or quit smoking within 15 years, and if you have at least a 20-pack year smoking history, what we mean by pack year history is you smoked a pack a day for 20 years or 2 packs a day for 10 years. If you answered yes to any of these questions, you would be eligible for a low-dose CT screening. And that's really important. What we're trying to stress is to get screened. When you look at screening across for other cancers across the nation, when we talk about mammograms for breast cancer, that's as high as 75%. For pap smears for women is in the mid-60s. Colonoscopy is at 50 to 60. When we get down to lung cancer, in 2005, it was only 5% of those that should be screened were getting screened. When we look across Illinois, we're a little higher than that at 6.3%. Iowa is higher at 10.4%, and the highest state is Massachusetts at 18.3%. So we have a long way to go to help with this. And I think education not only to patients, but also to practitioners, and how people come and get screened is the most important thing to help prevent lung cancer. So the key takeaways: prevention is key. Smoking needs to stop. Unfortunately, so does vape. Vaping is not an alternative to cigarettes. It is also shown to irritate your lungs It's also shown to cause inflammation within your lungs, and that can perpetuate to lung cancer. We do not have all the studies, as vaping is still new, but anything that irritates your lungs is going to do it. And in another example is if you look at Juul, one package from Juul is has much nicotine in it as a pack of cigarettes in one capsule. So that would not be good for your heart and your cardiovascular system as well. Know if you're eligible for lung screening. Ask your doctor. Ask a nurse navigator. You can come and ask me and see if you're eligible. Arm yourself with the information like we talked about today. Ask questions. Ask questions of your family. Ask questions of your friends. Have you been screened? Should you get screened? Maybe you should get screened. And obviously, be an advocate for you and your family's health. So thank you very much for giving me this time to talk about about lung cancer screening. November is National Lung Cancer Awareness Month, and thank you again.
Thank you, Dr. Yerkes. I was taking my notes here. You know, I had my pen in hand, and I really, on behalf of everyone, I really appreciate what you shared with us. Broke it down, the steps, and before the steps of how to prevent. You broke down what lung cancer is. You talked to us about the importance of taking care of our responsibilities to ensure that we are doing what we can to prevent ourselves from a risk like that. And I appreciate that. And so I want to remind everyone here that we're going to have a question and answer period in just about a few minutes here. And so if you have any lingering questions, I have a couple myself. And so I greatly encourage you to type in the chat box some questions. I've had a lot of great instructors in my lifetime, and I'm sure the instructor, Mr. Straps, will attest to this. Questions, there's no dumb question. And it's important to ask a question, even if you think you may know, because someone else may be curious behind to what you're thinking, and you could be a blessing to someone else potentially. And so please type your questions away. Next on our agenda, we have a video about a man by the name of Roosevelt who has tried multiple times to quit smoking. And we're going to learn about some trials that he had to go through that contribute to his smoking over his lifetime. So that's what you hear next.
I tried to quit probably, I would say at least maybe 100 times before I had my heart attack. Just like most smokers, we all know that we're doing something that we shouldn't be doing. So you're always, well, not always, because a lot of younger smokers think that they're not addicted and, you know, they can stop smoking anytime they want to stop smoking. But you're addicted to it, whether you want to face that fact or not, you know. And I don't think that there are too many smokers that really truly want to be smokers. It's just that you got caught up in that whole thing like everybody else, and you try to quit. And it's hard. That's like the hardest thing.
Quitting is hard. It really is. Fortunately for me, I cannot say that from experience, but I can speak to experiences from others that I know who had a history of smoking, and some had experiences like Roosevelt, where it was a health scare, some sort that allowed them the opportunity to quit on that 101st time, as Roosevelt stated. But often you're not that lucky, and so the message behind Roosevelt is one that I think resonates with a lot of people. a lot of families. And so for those of us who have loved ones who are currently in that position, such as Roosevelt that was in, trying to quit, I ask that you, be patient, but also be assertive with those that you love, with the information you can share to them, expressing to them why you love them, and it's not an attack on them, so to speak. And so I believe maybe we have some questions. I believe it's that time. Let me check here. If not, if Lord, like I said, I do have. I'll start off with a question, if you don't mind, if everyone doesn't mind. Dr. Yerkes, I was when you stated about the lung screening, you put up the criteria for to be screened, 50 years old to 80, pretty good health, I believe it was, a pack history of smoking, 20 for a pack a day, 10 years for 2 packs a day, right? And then I believe my memory is really good. Thank you for that, because you shook your head. That makes me feel so good because I was right. You said if you fit any of that criteria. So does that mean if I meet one of those check boxes, or do I gotta check all those boxes to fit that lung screening, early lung screening criteria?
So that's a good question, and the answer is, Mr. Brooks, is that you have to have all that criteria. So you have to be that age group, you have to have that smoking history, and the other one is to still be smoking or have quit within 15 years. So if you meet all those, we do recommend lung cancer screening, and in the nice states of Illinois and Iowa, it's covered by the Medicaid programs as well.
Awesome. That is good to know as well. That is covered in Medicaid as well. And so, is that process is it painful? Is it very time consuming? What should I be scared of to have that done besides ensuring that I'm healthy and ready to go?
Well, I think of all the screening tests, that the low dose screening is probably the easiest for everyone. It involves a CT scan. So you sit on a table and go through the CT scan machine, which is about a donut, and it literally takes probably anywhere between 3 to 5 minutes to do. There's no cutting, there's no issues with having to put in IVs or dyes or anything like that. And we get the pictures that we need at that time, and with no issues for the patient. So it's not like even colonoscopies or even mammograms. It's easier than all of those.
Thank you. All right, and this doesn't have the lung screen. I'm getting all mine out the way right now. Apparently, I have the mic, so I can do that. Yes. But in all seriousness, Dr. Yerkes, this is a question that several of my friends asked me, and they learned that I'll be taking part in this event. I put in my notes on my phone. Is it the process of smoking or the tobacco or nicotine that brings the risk to lung cancer and other type of cancer that smoking related?
So all tobacco, and depending upon which cigarettes you have, all contain carcinogens, known carcinogens. So the nicotine is more so to get you addicted, mind and body, and it also deals with your cardiovascular health. Nicotine drives up blood pressure, heart rate, and all of those things, which makes you at a higher risk for strokes and for heart attacks. And that's where we talked about, if you stop doing that and it washes out your body and your body gets back down to a regular level, you'll be at, and I think it was about 15 years, be at the normal non-smoking level. It's the carcinogens really in the tobacco that make you have cancer. And again, it's not just the lung cancer, it's the mouth cancer, it's the throat cancer, it's the esophagus. All those are related because it's everything that it touches. Anything that's constant irritation to your body can can make you have a cancer, not just if it's cancer causing. That's why people that go out in the sun get skin cancer, because they're chronically getting the UV radiation.
Constant irritation. I like how you put that. I'm gonna take that back with me. I'm gonna have to answer that at some time. Thank you, Dr. Yerkes. We do have another question here, and this goes back to the lung screening. It is, what if I'm losing insurance coverage in the near future? Can I get screening for my lungs?
I think that even without insurance, there are avenues and venues to work through that. We do get people, like I said, into the Medicaid program, and we can get them that way. I'm not sure what the pay out of pocket rate is for a CT scan, but usually usually there's ways to set up things that we can help with that.
Thank you for that. This is another question that is secondhand smoke related, and if you wouldn't mind answering this person had a little of a connection issue or had a problem with the secondhand smoke video we did, but they asked, what would you recommend for those who may be affected by secondhand smoke, knowing that it affects us like secondhand smoke?
So I think if people have already been affected, the most important thing is to stop further being around those people. Your lungs will, to some degree, repair themselves a little, but if you, again, goes back to that constant irritation, if you get away from that, you won't regress. So to some deal, if you see people who smoke for a very long period of time develop COPD, which is where their lungs can't oxygenate well, or emphysema, which is actually moth-eat in areas of the lung, which again don't allow for gas exchange. And when people get to those levels, we always obviously tell people to stop smoking, but sometimes the damage is already done, and what you want to do is help prevent further damage.
Awesome. And that's back to that constant irritation that you mentioned, and how critical that is to cancers and causing cancers. And so trying to keep yourself out of that, out of harm's way in that regard was critical. I believe we're going back a little bit to
Mary Kay O'Keefe.
Okay.
Mr. Brooks, I am at UnityPoint Health as well, and I'm a supervisor of our patient financial coordinating team. And I'd be glad to give contact information if anyone is facing losing insurance. It can be scary, or if they're uninsured at this time. I can give contact information for our team here at the hospital. We do help patients every day that are our current patients, but even our community members, we'd be glad to speak with anyone. Because as you and as well as Dr. Yerkes has mentioned, having insurance, getting the preventative care we need, catching things early is what this is about. And our number here in the Quad Cities is 309-779-2910. And any of our counselors would be glad to speak with someone who's unsure about their insurance choices or how to go about that. Right now, we are experts at Medicaid as well as federal marketplace, and there is an open enrollment going on. So we'd be glad to speak with anyone that's interested.
Awesome. Thank you, Mary, so much.
Sure.
And this might be a good time for me to remind everyone this is recorded. And this will be available on UnityPoint's website to review. So thank you, Mary.
Sure. Thank you.
I think I have another question here. If something is found on the screening, what happens next?
So the screening CT scan is what we get pictures for. So if we see something there, we have to determine kind of what the significance is. And every every patient is really individualized, meaning it's not clear cut for one person or another. Obviously, usually the first thing we do when we see something on a screening scan is, has anybody had any pictures at any other point in their lifetime or at either another center? What we find most times is they see something on a screening CT scan, but maybe you had a CT scan of your abdomen and pelvis when you had your gallbladder attack, and it caught the lower part of your chest and it wasn't there 2 years ago, or maybe it was. So obviously what we try to do is compare first to see if we can see when things started. And what we also do is then, depending upon how concerned we are, we may watch things if they're very, very small, because again, we can pick up things that are really half the size of a lentil at pea, and that you can't do anything with that size. And sometimes it requires further investigation, and obviously that would be leading up into a biopsy. And we do biopsies 3 different ways. If need be, sometimes we do them from the outside world, meaning a needle into something within the lung. Sometimes we do that the other way, from inside the airway into the lung tissue. And then lastly, if those aren't possible, there's always the possibility of a surgical biopsy. But the most important thing is to look at it and to take everyone in an individualized way. There's no real clear cut always. It's really having a specialist look at things and to help determine what the next step of action is and the next course of action is.
Thank you again. And I'm going to, just for good measure, I'm going to repeat that number that Mary gave us again here. It's 309-779-2910. And as Mary said, she'd be happy to review and help out with those who maybe are uninsured or facing the loss of insurance to explore their healthcare options. She's available Monday through Friday from 8 to 4:30. 309-779-2910. Awesome. Well, once again, I want to say thank Dr. Yerkes. I don't see any other questions. Maybe we have some more coming in, perhaps. But while we're checking for more questions, I want to send a couple of reminders for things to look ahead to. And I want everyone to save the date for January 27th, which will be the date in which there will be another event focusing on the health of Black men. And it'll be around heart health. There'll be more information coming out. I'm sure you'll be having to have it on UnityPoint website, and there'll be other ways in which it'll be marketed. So please have your eyes and ears ready and aware for that information as it comes out. We also will post a evaluation of the event, and in the link, we'll have a link in the chat here, and you'll also be able to find that again, as I said before. All of today, this hour has been recorded, and so if you don't get that link copied and or pop it up on your laptop now, you're able to find it again when you review the recording to hear the great information Dr. Yerkes presented. And so I hope everyone was able to gain a lot. I know I did. I have a bunch of notes that I kind of wrote down here that I'm going to take back home a little bit. Dr. Yerkes, if you get an email from me, I'm not that irritation. It's just me being a student, because what you share with us has high value, and your time is appreciated. And as I said before in the intro, I really want us as Black men to take more time and to focus on and understand the importance of, as I said earlier, what's tomorrow. We do a great job of focusing on the here and now. But oftentimes you focus on the here and now, it doesn't allow you to do what is best for yourself and your family later on or tomorrow. And me being a young gun, so to speak, being 28, I'm going to reference and quote Jay-Z, and I want you to follow me with this quote, okay? Because I believe it fits, okay? And before I use the word Dumbo, I want to be clear. Dumbo, it reference Brooklyn, York. They call it down under the Manhattan Bridge. And so he had a lyric in the song called Family Feud. He said, I could have bought a place in Dumbo for like $2 million. The same building today is worth $25 million. Guess how I'm feeling? Dumbo. And where does that fit in today? Because in the song, he references how essentially he didn't want to take a risk of buying this property then because he was thinking about the money he had now. And he was thinking about what he can do with that money now versus purchasing it for said building. And he fast forward 20 years, the building he could have bought for $2 million, he said, is now worth $25 million, which that's a lot more than two. I'm not a math major. I study history, but I do know 25 is more than two. And he's laughing at himself now. And he says he feels Dumbo because do the math, and because he wasn't had that forward thinking at the time to see where that $2 million investment would put him and his family for generational wealth. Talking finances here later on in life, and so I believe that is really appropriate, and it speaks to how we started off today talking about how we do the great job of focusing on now. We got to get the bills paid. We got to get food on the table. We got to get sneakers for tennis and for volleyball or basketball. The cars got to be run right. We got to make sure all this. And we do a great job of that. But are we doing our annual checks? Dr. Yerkes said he advises his clients. I wrote it down. Every time you schedule maintenance for your car, do one for yourself. And so we get the car taken care of because the oil has to be changed, the tire got to be rotated, all that good stuff. But when's the last time you've been to the doctor? When's the last time that we really considered our diet? And not really for ourselves, but the stability of the family. As men, our values are central to our family's future. Besides parenting kids, our kids from infancy to graduation. I'm not a parent yet, but most parents and older people that I speak to who have kids tell me the real parenting lessons begin after the age of 18. And they said, which speaks to the longevity, the need for longevity, because the talks and the understanding is different for our kids once they're grown. And so we need, the family needs us as men to be able to be around in those years when our experiences, our knowledge, just our presence is so important to the development and growth of our families. And so I want to stress to everyone here today, perhaps I'm overstressing it, and so I won't beat it too much, but I will just want to say here again, please utilize the resources we have here here locally, and with UnityPoint, referencing some resources we have here, locally, but also we have online things we can do. We have tobacco-free Quad Cities, and I will actually share these links in the chat, so that way they're available. But also for those of us that are thinking about quitting, and we're thinking about how difficult it may be, who do we turn to, who's going to help us with this. There's also a quit line that is Illinois Tobacco Quit Line. It's www.quityes.org, and you'll find a plethora of information about how to quit, where you can find supports for that. There's also even information about an 8-week free of nicotine replacement therapy program that provides, I believe they provide you with someone who they'll check in on you. I think they'll it's like a coach to make sure that you're able to do and you have the strength to keep fighting along, because as we know, both here today in this hour and before, quitting is hard, and you need a little assistance here and there to really be on top of your game. And so before I wrap it up, I do have these links here that I want to copy and paste in here. And so I want to again say thank you so much to everyone who has took time out of their day to be involved here with this event. I want to thank UnityPoint for being a great host and doing the important work of bringing these issues and these concerns to the forefront, and not only bring it to the forefront, but doing what we like to call as action, and having such an event where we could begin to raise the awareness, and hopefully we have learned some, and we'll continue to learn some actionable items we can take to be stronger and healthier for ourselves and our family. And of course, Dr. Yerkes, I want to thank you again for your time today. And lastly but not least, I want to thank you all here for joining us today for this hour here. And I did provide the links for the quit line and quit tobacco QC in the chat, I believe. And thank you so much. We will wrap it up, and I hope to see you all soon and healthy. And do not forget about January 27th, the Heart Health event for Black men that will be coming out. Thank you so much. Have a great rest of your night, and I'll see you soon.